We are now going to cover the 3 observational studies. We have cross-sectional, case control, and cohort. Cross-sectional is an observational study that collects information about individuals at a specific point in time. Okay, so if we think of an example, let's have our topic be about smoking. So, are you a smoker? So maybe this would be a survey, maybe this would be a phone call, but are you a smoker? So that means right now, today, are you a smoker? I'm not asking, were you a smoker? Do you plan on being a smoker? Right now, are you a smoker? So that would be cross-sectional. Case control studies, again, is an observational study that is retrospective. So that means looking back, so maybe at existing records or memory. So let's think of maybe an advantage of case control over cross-sectional. With a case control study, we have a control group. So there is a control and research group. What would maybe be a downfall? This could be maybe poor memories, or records may not exist. So what would be an example with the smoking topic? The long-term health of smoking by looking at old medical records. So anytime when they talk about history or the past, that's going to be case control because it is retrospective, looking back in time. And then cohort. This is an observational study that follows a group of individuals over a long period of time. And this is prospective. An example would be long-term health of smoking by following a group throughout the years. Some advantages of cohort. Well, in this case, if you compare it to case control, you do not need to rely on memory. What would be the disadvantage? Well, this could take a lot of time, right? If you're going to watch or follow a group over a long period of time, that's very time consuming, and with time consuming comes expenses. So it would be expensive as well. Determine whether each of the following studies depict an observational study or an experiment. If the researchers conducted an observational study, determine the type of observational study. A. Researchers wanted to assess the long-term psychological effects of children evacuated during World War II. They obtained a sample of 169 former evacuees and a control group of 43 people who were children during the war but were not evacuated. The subjects' mental states were evaluated using questionnaires. It was determined that the psychological well-being of the individuals was adversely affected by evacuation. So first, observational or design experiment. This is observational because no treatments are being implicated. So what kind? Case control, because we are looking back in time. So we're looking at the long term during World War II. So this would be case control. Xylitol was proven effective in preventing dental caries when included in food or gum. A total of 75 Peruvian children were given milk with and without xylitol, and were asked to evaluate the taste of each. Overall, the children preferred the milk flavored with xylitol. What do we think on this? This would be a designed experiment. So some Peruvian children were given milk with xylitol and some were not. Okay. C, a total of 974 homeless women in the Los Angeles area were surveyed to determine their level of satisfaction with the health care provided by shelter clinics versus the health care provided by government clinics. So observational or designed. This is observational. Are we looking at a specific time? Are we looking back? Or are we going forward following these women? We are asking them at a specific time their satisfaction level. So this would be cross-sectional. And D. The Cancer Prevention Study 2 is funded and conducted by the American Cancer Society. Its goal is to examine the relationship among environmental and lifestyle factors on cancer cases by tracking approximately 1.2 million men and women. Study participants completed an initial study questionnaire in 1982, providing information on a range of lifestyle factors such as diet, alcohol, tobacco use, occupation, medical history, and family cancer history. These data have been examined extensively in relation to cancer mortality. Vital status of study participants is updated biennially. Cause of death has been documented for over 98% of all deaths that have occurred. Mortality follow-up of the CPS2 participants is complete through 2002 and is expected to continue for many years. Okay, here, I'm just going to highlight that. So first of all, observational or designed, right? Because they're following them. They're not implementing any kind of treatments. Case control, cross-sectional, or cohort. Well, it's not cross-sectional because we're not looking at a specific time. You may think it's case control because we see 1982, but it's actually cohort because it's going to continue for many years. This is a cohort. So there is data sets that already exist. Some agencies that regularly collect data that are available to the public are the census. This happens every 10 years. The IRS. And the Department of Justice. There are more out there. I'm just going to list those. Why is the census important? The results are used to determine the number of representatives in each state in the House of Representatives So every state gets 2 senators, no matter their population. But for the House of Representatives, this is based on the proportion of the population for each state. So the populations change first for each state and then for the country. So a new proportion has to be determined every 10 years. And then that's how our House of Representatives get reallocated. There are a total of 435 representatives. It is also used to distribute funds. Maybe planning. It is used to plan for road construction and schools. And this list can go on and on because the census is very important. There is a lot of uses for this. That is the end of section 1.2.